Good morning. It's a pleasure to be here. And I'm going to talk about the importance of pretreatment counseling. So let's think a little bit about what we know. Over the course of the past decade or 15 years, there has been increasing focus and interest in understanding the importance of what we do on the front end of care. In general, we've come to realize that when men and partners have unrealistic expectations, it is more likely to result in decisional regret, and we know this links closely to decreased quality of life. What about uptake, about sexual recovery? I want to share a little bit of information from one study, which I think characterizes much of what we've come to realize. When this study that was done now about 10 years ago followed about 100 prostate cancer patients from before their surgery for closely followed to 18 months later. What we know is that about half of those folks do not engage in any use of erectile aids, of sexual recovery. We know that for the half of men who do go on to try, the majority of those men discontinue treatment. Bottom line is that when we talk with patients and partners about why they do or do not engage in these kinds of recovery efforts, people say that, gosh, it just didn't meet my expectations. And they also say, well, loss of interest. I want to talk a little bit more about that. But when we look across the board, about 50% of folks simply do not use erectile aids, and they do not continue over time. It's a pretty significant number when we know what the outcomes are. So why might that be the case? Well, in general, we know that sexual health and sexual recovery is really at the intersection of physical, psychological, interpersonal experience with the large sociocultural overlay that affects everybody. All of those domains are potentially impacted by treatment. And in reality, when people get help, most of the time it is very narrow, only tied to the physiology. In fact, we know that when people need to move forward, often many of those domains are disrupted and need to be addressed. So why is pretreatment counseling important? First of all, patients assume most of the time that erectile function will not be impacted to the level that it might be. People assume, I'll just take a pill, that use of erectile aids or sexual recovery is going to be easy, is going to be straightforward. We know it is not. More importantly, when things are stressful, when things do not work as well as people assume, patients and partners often get locked into what we call an anxiety avoidance cycle. What does that mean? People feel distressed. People inherently want to avoid something that's upsetting or distressing. And in the short term, it feels better. That intensity of avoidance is helpful because in the short term, you feel some relief, but there is no powerful motivator to keep avoiding than that kind of short-term relief. So really, that kind of pre-treatment piece is very important because otherwise people often have this kind of cycle. So what does that mean specifically? We need to set expectations, and we know that that is often linked to reduction of regret. So I'll give you an example of an interesting study that was done looking at pretreatment counseling. Essentially, half of men that were scheduled for prostatectomy were given usual care versus one educational session. This was one session that was focused on both clarifying physical and psychological aspects of recovery. And when folks were assessed about a year later, looking at decisional regret, 20% of men in usual care said they were sorry they did what they did, compared to one man who had less than 1% in pretreatment counseling. Also, just want to comment quickly, the value of this pretreatment counseling is important to engage with the partner. Lots of focus now on understanding that, again, people are not an island. We are working in a context. Interesting study looking at use of ICI after either cystectomy or prostatectomy, where folks were either given some short-term counseling in addition to a teaching sheet or teaching sheet alone. Close follow-up up to 18 months later, folks who had had the small amount of counseling were very compliant with ICI. That was very different than when we saw with just teaching sheet alone. More importantly, not just IIEF, but satisfaction was higher. I will comment quickly on work that's been done by Dr. Chris Nelson, who again has helped us really understand what kind of counseling is important. What is the value of the counseling we do? It matters on the type of counseling. ACT is one type of framework for behavioral intervention that is very much focused, among many things, on looking at helping people identify specific values, helping people have concordant behavior with what their goals are, and distress tolerance. When you look, again, this is a study that Dr. Nelson did, again, looking at folks who received a short-term ACT-based therapy or counseling in addition to enhanced monitoring. When you look over time, the use of injection therapy is actually higher and compliance was much better. And this is something, again, it really speaks to the power of a short-term therapy that can really address these issues. So I would say good news is that when people know what to expect, when people have realistic expectations, and they're able to sort of target their goals to those expectations, we know outcomes are better. Pre-treatment counseling does not need to be lengthy. We are not talking about intensive psychotherapy or sex therapy, but we know that when we take a whole person approach, outcomes are significantly improved. Thank you.